He's the former president and publisher of the Sun Herald, and now he's on the radio. Welcome to Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome to Coast View, the show that celebrates the men and women who are making coastal Mississippi a better place to live, work, and play. Today, we got a great show. We have the president and CEO of Memorial Hospital at Gulfport, Kent Nicaud. And in the second half, I'm going to share sort of a personal story with you about the current situation, current unrest in America. We'll come to that in the second half. But for the first part, let's just turn to Kent and say hello. How are you doing, buddy?
Hey, Ricky, doing great. How are you doing?
I'm doing very well. Doing very well. Hey, I noticed recently, before we get to the nitty gritty, I noticed recently you guys had a concert for your staff and the frontline workers by the New Orleans-based singer-songwriter Elizabeth Lyons. And that song she did, Brave Enough, was such a special song. What a great opportunity to kind of pause for a second and be reminded how important the staff is and the work that they've been doing for months now around just, being ready, the COVID situation, trying to keep business as usual going along. It was a good opportunity to focus on your team, wasn't it?
Oh, absolutely. Everyone has been so engaged with supporting not just healthcare, but frontline workers, the force, the sheriff offices, and what work they've been doing to sort of take care of our community. Elizabeth's song, it wasn't just about the pandemic, but just about the overall effect on the country. Whether it's diversity issues, whether it's the pandemic, whether it's a financial and joblessness that we're currently seeing. So it truly just sort of was great words. And if you get a chance to listen to the song and look at the words, it's pretty powerful. She did a nice job.
Well, I thank you for kind of bringing her to light for us here in coastal Mississippi. For those who are listening, just be aware that we've had a pretty good tropical storm, a thunderstorm that came through. It's kind of affected the Wi-Fi connection a little bit, but just bear with us. Hey, one other thing, you probably know this. I think, in fact, you do know this, that Dr. Nicholas Conger has been on the show many times, and he's been a really good friend to me and to the show, and has done such a great job of just taking a very practical view toward the situation and helping people understand the changes that are happening, the new numbers, what they suggest, some of the new science around the face mask and all of that. As people sort of wanted to go back to getting the economy back open again, it was great to have his voice of reason to constantly remind people, and he'll be on the show again, to constantly remind people why we can't drop our guard. Anyway, I just wanted you to know he's been a super representative of the hospital.
Yeah, when day one, when we stood up the task force, he was that medical leader that truly just took the bull by the horns and was truly that physician champion. Not just for the task force, but for the state. Early on, we created a relationship with our Dobbs, and he got to be sensationalist about understanding why some decisions were being made and how the go forward would be.
Yeah, he really has such a clear understanding of that. And again, I focus on this because he has a very practical way of communicating, so that he's not speaking to the general public in a bunch of glowing medical terms, but he speaks in a very plain language that people can understand, that people support. And by the way, when I have him on the show, they're some of the best viewed videos that we've got. People like to share what he has to say, and it's just been terrific. So why don't you let's give us the yeah. Go ahead. I'm sorry. Go ahead.
No, he's just such a good guy. But you're right. He puts it in terms that everyone understands. So while he can talk the medical talk with Dr. Dobbs, the reality is he brings it to a level where we can all understand and appreciate. So yeah.
Yeah, it's been terrific. And what we've actually developed a bit of a friendship, and I'll share stories that I come across, some of the latest around the world, and he'll share the same with me, and we're just making sure that each other doesn't miss anything. So it's been really a lot of help for me as I've tried to keep people informed and continually reminding people, do not drop your guard. I mean, we've got to continue to practice social distancing. We've got to wear the face mask when we're indoors, got to wash our hands, got to do all those things because this thing is not going away. And what I say on the show all the time is that COVID-19 will find the cracks in the system if we drop our guard. So anyway, what's the latest? Tell me the latest on COVID-19. How's it going there at the hospital? What are some of your team's biggest concerns these days?
We're fortunate in the state. The state's still having some PPE issues, lab issues, but we've been pretty fortunate with our PPE and labs. We have access to a rapid test where we can get results in 2 hours, which has been a true blessing for us. I think with Memorial Day, just as you were talking about, I think people did drop their guard. I think we had an influx of who were just ready to get out and if you drove the beaches a weekend, you would have not known anything was going on. And I think we're seeing a little bump in positives because of that weekend. Um, our testing positive ratios is higher than it's ever been. Doesn't mean we're seeing a lot, but we're seeing a bump. Now it's people that are understanding what it is, so people aren't getting as sick or catching it quicker. So they're being sent home for a 14-day quarantine. So while people are acknowledging that it is still here, they're more comfortable um, that they can beat this, and that's the sad part of the story because people don't realize that you could be a carrier and bring it to someone who has an immune system or an older person that can truly die from this disease. There's 2 million confirmed positives in the country, almost 119,000 deaths, and 850-ish, 867, I think, in here and people just can't let their guard down. You go to the grocery, go to Walmart, and have. I would say probably now the 10% of people are active. Others are just walking around like it's the normal day. So
Yeah.
people need to realize the problem still exists and it'll be with us for another 12 to 18 months.
Yeah,
So,
it
so
is.
you know,
Yeah, go ahead.
let's say so the hospital's doing well. People are tired. We're still cohorting COVIDs. We have 8 in the hospital now.
Say that
And
again. You have
and
eight.
you
You
know
have
we're
eight.
we're
You have eight. You said.
we're 8 currently.
Yeah.
Yes. So we have done really really well in Harrison County. I think you've seen some of the stats. We're one of the counties in the state that truly is. I think we have a 0.15% population of positive confirms, which is the lowest in the counties in the state, considering Harrison's one of the largest. So we've done really good job. Um, but because of that, we've been reaching out, helping other smaller counties, particularly with their nursing homes. We helped a nursing home 2 weekends ago that had 21 confirmed positives in one nursing home. And that's just crazy. But that's how quick something like this can change just by one person carrying and walking in and passing it on.
Dr. Nicholas Conger has talked about that just about every time we've talked. That it's so important for us to be super aggressive with testing around nursing homes, the people who go in and out of nursing homes, and to be just super proactive. But unless you're being proactive in that arena, given that's where a lot of the outbreaks have occurred across the United States, some bad things are going to happen. And in some ways, it's almost unbelievable that it still happens. Given what we know about it now. Hopefully, you guys can, in a leadership role, as you begin to reach out with these folks, that you help them, help other nursing homes see the need to be super proactive as well.
Yeah, 100%. And I think the state now realizes that. Dr. Dobbs has initiated with the National Guard 100% testing of residents and employees at nursing homes. Last week, I don't know if you got to see the nursing home listing that was released of the positives that were at each nursing home. You notice in Harrison County, there are 853 nursing home beds, only 7 outbreaks, which is pretty strong. Memorial owns 3 nursing homes, and our name wasn't even on the list because we've actually had 0 residents or employees at any of our 3 nursing homes. So very proud of that. But that's because we put a hospital policy attached to that nursing home early on. So I'm really convinced that that sort of changed that model for us. Additionally, I think we need to be conscious of who that high risk person is, and particularly, be socially conscious all the time. But gosh, don't get your parents or your grandparents sick, unnecessarily.
Let's do this, Kent. I want to come back in the next segment, and I want to hammer that point home that people cannot drop their guards and why they can't drop their guards. This is Kent Nicaud, who's the president and CEO of Memorial Hospital at Gulfport, and we'll be back after this break.
Listen live or on demand and watch episodes of Coast View on your laptop, desktop, or on your phone or tablet by going to supertalkmsgulfcoast.com.
Talking to the people that help make the coast such a unique place to live. This is Coast View with Ricky Matthews on SuperTalk Mississippi Gulf Coast 103.1.
Welcome back to Coast View. We've got Kent Nicaud, the president and CEO of Memorial Hospital at Gulfport, and a good friend of this show, someone who's been incredibly proactive about the COVID-19 situation from the very beginning. He and his team have got out front on testing, doing the drive-in, or what do you call it, the drive-by testing or remote testing, whatever you did there. Drive-through testing. And have really done a good job of leading not only in Harrison County but beyond to help other organizations that are charged with helping people and the elderly and those who may have some kind of pre-existing condition to understand what they need to do to make sure they keep people safe. But one of the things I keep talking about on this show is that it's critical to reopening our economy. It's critical to tourism and everything that goes with that we continue to send the message to the world that this is a safe place to visit, and that every coastal Mississippian has a part to play in that. And dropping their guard such that it could contribute to some sort of outbreak that would set us back is something we have to remind people not to do. So make your plea one last time, Kent, before we move on to talk about other stuff happening at the hospital.
Yeah, look, we have conscious about that this is still and in our communities everywhere. Being conscious about it is going to help us sort of set the stage for when we move forward, hopefully sooner than 12 months before there's a vaccine for this. But right now we've got to be conscious. We cannot hurt our loved ones, and essentially losing your guard, letting it down, and not being conscious, you're going to have, whether it's yours or family, some connectivity. It's dangerous. And one of the things I've been trying to tell people is hospitals are the safest place to be. We are very conscious about it. We're not letting our guard down. We are very limited to visitors. Currently, we're only allowing 1 visitor per 24 hours per patient. We don't want people coming and going. So we're screening everyone who walks in our doors. Our guard is not down. The rest of the communities need to realize that and be the same. As we move forward, you can see people getting more and more comfortable. That does not help us. I mentioned earlier that we're starting to see a little spike, and I believe it's from the Memorial Day weekend. People were having a great time. The weather was amazing. They were outside, gathering at parties, and we're seeing a spike. Now people are aware of what they may have, so they're getting tested sooner. So we're catching it sooner before the sickness, really people get sick. But being conscious and understanding doesn't help those weak immune systems or older folks, because they can take a dive pretty quickly, as you experience in nursing homes. It takes one person to go into a nursing home, and then you'll have an outbreak that you can truly have, anywhere from 5 to 20 something deaths. So we've got to be cautious, be conscious about how we're carrying ourselves and presenting ourselves from a social distancing standpoint.
We're talking with Kent Nicaud, the president and CEO of Memorial Hospital at Gulfport, and you see what's happening in Montgomery, with some of those hospitals getting overwhelmed, and I can hear in the governor's voice when he does his daily briefings, and of course with Dr. Dobbs as well, that they're genuinely concerned that we're gonna continue to experience a spike. And I think the thing that people need to understand is that if we have outbreaks that begin to put stress on our medical institutions, what we'll find is immediately it will trigger a scenario where we move back a phase, and we don't want to be locked down in any way. I mean, it would be detrimental to the economic situation of coastal Mississippi for us to have to go back. And it wouldn't take much, would it, Kent, for us to see that you're concerned, and now we've got to figure out what we're going to do to manage it.
No, Rick, you're 100% right. I sit on the governor's task force in Jackson for COVID-19, and those are the exact discussions we have monthly. Concern is what happens when, because spikes will come. Are they manageable?
Yeah.
An unmanageable spike, what happens? Do we shut down everything? Our development cannot stand for that again. Concerned that several, at least hospital, rural systems won't the first pandemic. While this is ongoing, we got to be conscious of that economic balance, and I think that's what the governor is struggling with. We're about 88% back to our pre-COVID normal now. Taking another hit somewhere down the line, that's a financial stress, and we haven't had any furloughs. We've maintained our current budget intact, but we can sustain that for only so often. We're still looking at a very major loss due to no electives being here for quite a period. So the stressors to the economy is real, especially here in the coast. Restaurants are not reopening. That's very sad, because that's one of the powerful things the coast had to offer. And I'm fortunate because I am in the restaurant business too. We have been socially conscious and pretty aware of being a model that other restaurateurs would follow, that we need to protect our customers. And I think we've done a good job at that. And some to go through that process, if they're reopening. I can't stress enough, is the safest place for anyone to go. Everyone needs to understand that, because one of the things we're seeing now is that people are coming into our ER, they're sicker than they used to be coming into our ER, and we're having higher admissions from that ER because people are waiting for a longer period of time to come to the ER. ER is we're COVID conscious, so we're protecting our visitors and our patients. So don't wait, don't let it get to be too late before you come to the ER.
So as I explained earlier, we've dealt with some Wi-Fi issues during this conversation. I think most people who are listening are used to that, because so many remote Wi-Fi interviews like this are taking place across America. But one of the things that Kent Nicaud from the Memorial said is that they've moved their volumes back up, and not where they needed to be. They're still not where they need to be, but they're making progress. But an outbreak would set us back. The hospital is one of the safest places you can go, because they do not drop their guard there. And one of the points, I think it's so important that for whatever reason, I think people are maybe delaying doing their elective surgery, or maybe delaying going to the emergency room if they've got a serious issue. And that's just not safe. Go ahead and move forward. If you've got a medical condition that you need to have attention to, know that you can go to Memorial. They're full staffed. They haven't furloughed anyone. They're ready to help you. and it's going to be safe. And don't wait. Don't make your condition worse while waiting. That's probably the most important message we could get across to people. By the way, have you seen the pent-up demand for elective surgery beginning to sort of come forward?
Yeah, I think the state is having, again, I sit on the task force at the state level, and in the Jackson market, for example, they're having a concern with people are canceling electives. They're saying, I'll just put it off. We have been fortunate that we're not experiencing that. We have actually did a campaign about 3 weeks ago, letting people know that it's very safe to come here. Don't let things wait too long. And so we have a pipeline that's been built up of the elective cases, and we've been processing through that. And I'll tell you, we actually did not just turn the faucet on. We sort of gently opened it over a couple of weeks so we wouldn't overload our staff. But it's turned on now, and things have been going pretty smooth. Of course, the storm, but we once again we weathered that storm and got through it.
I said on the air many times that tropical storm we just experienced was one of the most significant tropical storms I've ever experienced, and hopefully that's our one storm for the year. You know, we had ours. If there's any more in this supposed to be active season, it can go somewhere else. But you know, I'm glad to hear. I'm glad to hear that you're beginning to kind of operate again, and literally and figuratively, so that you can be healthy, because the medical institutions of coastal Mississippi, especially Memorial, has to be healthy, because we're going to be in this COVID environment for a while. And as you discussed the last time we talked, life goes on, sickness goes on, people still have needs beyond COVID, and we need to be a fully functioning medical facility that can do everything that people need. And you guys have been super focused on making sure that's the case. And I really appreciate that, Kent. It's been great watching your leadership and seeing what Memorial has done. Any final thoughts before we sign off?
I think a lot of key points you hit on, which were very, very strong. Y'all don't let your guard down. It is still very, very real. Like I said, we're seeing a little pickup here in the coast and positives. The state the last 2 days, 498 reported positive the day before yesterday, 390 something yesterday. Labs are backed up. So I think we're getting a couple of days together, but still, they're real. Be socially conscious. Be aware that you don't want to hurt a loved one, because it can still happen.
Thank you, Kent. This has been Kent Nicaud, and we'll be back after this break.
Subscribe for free to the Coast View podcast on iTunes, Google Podcasts, Spotify, or wherever you get your podcasts.